you can treat the patient much better and with much less medication so that he is well in the next day. Well, the thing is actually because we are oscillating between sleeplessness and excessive sleep. But in between the two, there's a huge spectrum of diseases which we are missing. Now, we have to first understand that, and that we can easily do by a sleep study. The patient has to get admitted overnight and he comes after the dinner, and by morning he goes back around 7 o'clock, 8 o'clock. The thing is, essentially he has come to sleep, and we record various parameters like his brain activity, his eyes activity, his heart activity, his oxygen saturation in the blood, his how many time of arousals are there, and the quality of sleep, what is the percentage of deep sleep, light sleep, dreamy sleep. So that is a complete thing. And a lot of patients come to us from outside. When they come, they are already having almost a pharmacy inside their body. That is basically, okay, they are taking 12, 13, 14 tablets where you are using tranquilizers, hypnotics, sedatives, and even antidepressants. But little realizing that we may not need them, because these medicines themselves get them like a zombie in the day. So the idea of sleep is not just making you sleep. The idea is to making you wake up correct, so that they can do their daily jobs better. There is, if you say the terminology like a carpet bombing, that initially used to be there in the years when you keep on throwing the bombs, that at least somebody will die. Now today is basically the role of like surgical strikes. You have a chalked out area and you enter into that. Or you can say laser bombing, where you know where you have to hit. Once you have diagnosed it correctly, you can treat the patient much better and with much less medication so that he is well in the next day. That we don't want to sedate a person. We want him good in the daytime, and he should be able to sleep in the night with good quality of sleep. So that is where the whole situation comes. And there are so many disorders. There are more than 80 sleep disorders. Having said that, yes, there are few which are very prominent, and there are few which are remote, where we have to do a bit more brain exercise as to this might be the thing. Like we have say snoring and sleep apnea, we have insomnias of different category, and these categories I will rather call them dysomnia rather than insomnia, because insomnia per se means total absence of sleep, which is a rare phenomena, because a person, if he is not sleeping for 9 to 10 days, it is incompatible with life. So they get the sleep, but it is broken and fragmented sleep, and according to them they are not sleeping. So it's not that they are telling a lie, but that is their perception of their sleep, and we have to change that perception. Once we know the diagnosis, we will be able to do it in quite a large number of cases.